Hello and a very warm welcome to Women's World, a program especially related to women, and I'm Dechen Om with the program. In this edition, we'll talk about pregnancy care and the recently introduced antenatal and postnatal class at the National Referral Hospital in Thimphu. Motherhood is one of the best feelings a woman can experience. But pregnancy, the first step of motherhood itself, is very painful for some, while for some it is not much. However, should you have a healthy baby or not, it all depends on how you plan and take care of yourself when you are pregnant. A gynecologist at the Jimmy Doji Wangchuk National Referral Hospital, Dr. Phup Doji, talks about the right age for women to get pregnant.
The ideal age would be from 20 to 30, and the best age to get the first pregnancy is around 25. After 30 till 35, it's still considered good, but definitely after age 35, it is considered quite risky.
Let's find out what are the risks associated with women who get pregnant late.
So after age 35, the eggs, when they fertilize from the mother side, the eggs have been stored for a long time. So that's why there are certain problems that are related with the long duration storage for the egg. So sometimes you can have baby with chromosomal problem. That's the main reason.
I spoke to some of the women about morning sickness, which most women experience during the early stages of pregnancy. They said some go through painful ones, while some go through mild ones.
My pregnancy, I used to have vomiting till 3 to 4 months. Then after that, I used to get okay. Never had any problem, only just vomiting. Till the end of my delivery, I worked. Maybe I worked in the morning, then evening I used to deliver.
For the first pregnancy, it was difficult. I did get sick for the first month. But then for the second, I didn't get sick at all. Yeah.
Sick as such, I didn't really get sick, but I had a little bit of difficulty towards the end of the pregnancy, especially due to increase in blood pressure and swelling and all.
Why is it that some women get morning sickness only for a couple of months, while some continue for long? Dr. Phup Doji explains about the difference in duration of morning sickness that women experience.
Vomiting in pregnancy in general, it is a common problem faced by every woman, especially in the first pregnancy. And that occurs in 80%, and it should subside by end of 3 months. But among this group, there are 1 or 2 women who will be vomiting, say maybe till end of 5th month, 6th month. And there are 1 or 2, I met in my last 12 years, 2 ladies who vomited throughout pregnancy. But with their nutritional supplement and from the hospital care-based program, they had a normal delivery.
Meanwhile, recently, the Jimmy Doji Wangchuk National Referral Hospital in Thimphu introduced antenatal and postnatal classes for pregnant women.
Breathing techniques during labor assist you to relax during and between contractions, conserve energy, and increase oxygen to the uterine muscle and your baby.
Physiotherapist Tilawangwu says the classes will help prepare pregnant women for labor, birth, and early parenthood.
It's been around 2 months. Antenatal classes, especially to promote healthy pregnancy and to mentally and physically prepare women for childbirth, and then to prevent post-delivery complications. It's more of a preventive measures, especially like first-time mothers. When they go to delivery labor, they don't know how to cope up with pain. Then we can prevent lots of complications. In this class, we teach them how to cope up with pain, then how to peer down, even the postpartum complications and all.
During pregnancy, one experiences new taste turn-ons and turn-offs. Some develop craving for a particular type of food, while some lose appetite.
I could eat very well. I had craving for a certain kind of food, especially sour food and jelly. That was my craving. My appetite was good. I could eat anything that was brought in front of me. So
I could eat the same as I used to eat. Usually the mothers used to have craving on the sour thing and all. So for me, it didn't happen actually.
It is recommended that pregnant women should at least try to eat near to balanced diet, which comprises of carbohydrate, fats, lipid, protein, micronutrients, and fresh fruits and vegetables. Meanwhile, for vegetarian pregnant women, the main problem is source of protein, so Dr. Phupdoji gives some tips on what to eat for protein.
If somebody is pregnant and is a pure vegetarian, I personally recommend that they should take soybean plus any form of lentils or dal category. If you combine refined soybean oil with any form of dal or lentils, then it forms first class protein. Another is Nutrilla. Nutrilla also has some good amount of protein. And then there are different categories of vegetarians. Some take egg, that's fine, they should continue. Those who do not take egg, they do take milk, so they should increase their milk intake.
Let's find out at what months of pregnancy women are referred to the antenatal class and what they are taught.
First, we see when they are 30 weeks of pregnant, but after 2 weeks, we review again and then we teach another exercises. When it's near to the due date, we ask them to come weekly, every weekly. In 30 weeks, we just teach them some introductory program where we teach them about the pelvic organs, then the introduction to all the anatomical and physiological changes during pregnancy, and then we give even the health education on back care, diet, then maintaining of postures and all. Then after that, when they are around 35 weeks, we teach them of different types of breathing exercise. Then we demonstrate, let them practice, and then we teach all the relaxation techniques in it. Then by 37 weeks, the same thing we do, but we include all the stretching, strengthening exercises. And then if they have any specific problem, right, by 37 weeks, they have put on weight, the baby is growing and lots of stress on their body is there, so we teach them how to take care of that. If they have a soiling or a back care, we teach, according to the women's problem.
Weight of most women fluctuate during and after pregnancy. From the women I spoke to, most gained weight while some remained the same.
Towards the end, yes, I gained weight. That was just 61. That was the highest I used to gain, but my children were above 3 kgs.
I gained a lot of weight. After pregnancy also I gained. I was 60 before my pregnancy. Then I think I gained around 20 kgs, I think.
Previously, in the earlier months, I think there was not much difference. But towards the end, I suddenly gained a lot of weight. And after the pregnancy also. So I had gained 15 to 20 kilos and all.
Dr. Phup explains about the ideal weight one should put on during pregnancy.
Ideal weight gain in pregnancy, we say that minimum of 10 kg. But this is to a woman pre-pregnancy, her body weight should be below 60. If somebody's body weight is more than 60 kg in Bhutan, to those, the ideal weight gain should be between 5 to 10 kg. Because more obese the mother, she should not put extra weight. If somebody is around 80 kg, then her ideal weight gain in pregnancy should be 5 kg.
Dr. Phup says it is good to exercise during pregnancy as it helps during the time of delivery.
Does exercise help? Yes, it definitely helps. Those who do manual work, we have seen that especially women come from the village, they do have an easy labor. So definitely there is a huge benefit in terms of delivery, and maybe that has a direct contribution to the body health status.
Let's see whether women exercise during pregnancy or not.
Exercise during pregnancy, not much, but I used to go for walk and all. And after pregnancy, I didn't really do exercise as such.
No, I never followed. Maybe the exercise I get in the water was more than enough because we tend to walk very fast. Most of the time we are walking around. I think that was enough exercise for me.
I did go for walks, but no exercise as such, but little walk in the evenings.
Dr. Phup suggests some of the exercises that one should do during pregnancy.
In Bhutan, the best exercise would be walking. So women who are living in the cities and who do not do physical work, they should at least walk every day for 3 to 5 kilometers, at least twice a week. Beyond that, those who can afford, if there are facilities, next is the swimming. Swimming is the best form of exercise in pregnancy, and next is walking. So any exercise the woman can do, provided that there should not be too much pressure on her tummy. One is to avoid pressure, two is to avoid certain shock and jerks to the abdomen. It will cause dislocation of the placenta and cause premature labor or miscarriage.
Meanwhile, some women go through complications during and after pregnancy.
For the second, I had a difficult pregnancy because my daughter was born 1 month early. We had to stay in the ICU for about 2 weeks. I think the fetus was under distress. She had some problem with her heart, so that's why we had to take her out prematurely.
I had retained placenta in all my 3 deliveries. Maybe like placenta should be out by 5 to 15 minutes. Mine used to like be half an hour, 45 minutes. So it used to be removed manually.
I underwent induced. After all the doses also, I didn't get any labor pain. Actual problem with me was my child is big in size and the head was not actually engaged. So that's why I had to undergo C-section.
The postnatal class helps women to shape up after birth. Physiotherapist Tilawangmo explains some of the common complications women face after delivery.
We also see lots of postpartum cases also, especially after the delivery they have this postpartum pelvic pain and then even backache because all their abdominal muscles are stretched out and then they have lots of problems. And even we see urinary incontinence, especially after bearing the baby for 9 months. And then during the trials of labor, all the muscles are stretched and drawn. And then that time, especially that pelvic floor muscles, it gets weakened. So as you age, even like after repeated delivery, 1, 2, 3 children, it becomes more weakened. And then as you age, it becomes so weak that sometimes even we get organ prolapse. Especially after the trials of labor, then bearing the baby for 9 months, all your pelvic organs becomes weak. We have a muscle like pelvic floor muscles, so all this becomes weakened, and then later when you age, like when after the menopausal, right, after like around 50 years, you get all complications. Pelvic organ prolapse and all. So, but from right now, if you do all this exercise and all, then I think you can prevent these problems. We teach them how to strengthen their abdominal muscles, even the pelvic floor muscles, and how to maintain their posture. Even breastfeeding, while breastfeeding, how to maintain your postures, and then getting back into shape.
The antenatal and the postnatal class also makes the husbands or the partners to get involved so that they understand the changes that women go through.
Especially, like all of us consider health means only the physical pain and physical discomfort, but actually even when you're pregnant, the pregnant lady goes through lots of changes like mood swings, all the emotional imbalances and all. So we do teach them all the exercises to relax them and then to control their moods and all. There's lots of emotional imbalances, and even after the delivery, they go into postpartum depression. So in our postnatal, we are planning to, bring all the mothers together, share their problems, and then discuss all the problems, whether it's with the baby or with their physical body, and then get the support and prevent all this postpartum depression and all. By like around 39 weeks near to their due date, we do make the husband or the attendant to participate in this program, especially to help the women when they're into pain, when they're in the process of labor, right? So we tell the husband or the attendant to participate and then, reinforce the women with all the exercises which we teach over here. So especially when you're in the very intense pain, you tend to forget everything, whatever classes or you have taken, you forget everything. So in that time, the husband should step in and then take an active participation.
Dr. Phupdoji says a woman should come for a minimum of 8 checkups during pregnancy so that the health of both mother and the baby is monitored. According to the UNDP, Bhutan is well on track to achieve the target of reducing the maternal mortality rates to below 140 per 100,000 live births by 2015. That's all we have for this edition of Women's World. Join us every Wednesdays and Sundays at 4:20 p.m. for more women-related issues. Till then, it's me, Dechen Om, saying goodbye for now and see you next time.